and I am a scientist by training. Went through all those years of scientific training and self-directed research, and realized for the kinds of roles I wanted to pursue in my career later, sort of mid-stage in my career, it wasn't about my scientific skills. It wasn't about being analytical, and I'm horribly, or I guess wonderfully analytical. I don't know which. But there are some situations when you're trying to build, particularly in a leadership role, where it's not about digesting something into small steps that can be analyzed logically. Sometimes it's more about building a group ambition so you can achieve something. And so for me, the behavior that I needed to channel in the right way was the analytical piece. And then the behavior I needed to develop was really one of leadership and collaboration.
Yeah, I can expand similarly on that. I'm thinking of two different roles. When I was in regulatory, and coming up the road from clinical, I may have had the depth in an area, but in regulatory, the point you made earlier, you kind of, the central neuron, bringing in all the functions together. So it's really important that you learn to listen to other people's perspectives. You may know what the health authorities want, but you may not know the science to the depth of the scientists, or you have to be the translator of what the regulations are. So I think in speaking to people, sometimes we find that you want to be heard. There comes this point where you're not heard, particularly in a world, sorry for the man in the room, but many of us are surrounded by men. That can be very, at least historically for me, I had trouble with that. I just completed a general management program a couple of years back at Harvard, and 8 of my roommates were men, and it really helped me because initially they filmed us and I wouldn't sit at the table because I didn't think my voice mattered. And they said, wait a minute, what did you say, Penny? And I'd say something, they'd say, move over, get closer at the table. And they also helped me speak in sound bites because I guess I was a little verbose and passionate about my science and what I was doing, and they just wanted the bottom line. So I had to learn how to translate who my audience was. And I also observed certain males I worked with. I used to work with this great guy, John Messina, a lot of you know him. And I watched him in a meeting, and I'd say something at the beginning, no feedback. He'd say exactly what I said at the end, and everyone would go, great point, John! How does he do that? How does he do that? Aha! He waits to the end. He patiently listens to all the stuff in the room, and then he thinks, what should I repeat? So I observed. So I took a lot of that in, and it's really been a journey because now I'm in a role as an individual contributor where my day is self-directed, and that's been hard. And that's actually been really hard for me because when I was on the product side, it was driven by the company's milestones. I knew I had an NDA to do. I could put the plan together, get the team going, and day to day I knew what I was doing. Now I wake up, should I start with the FDA? Should I start with Europe? And I have to make a day-to-day plan. But again, looking at what gives you joy, how could you thrive? So then I look at that as an opportunity. Okay, I have this clean plate before me. Today it's Monday. What am I going to create today? So I start looking at that and try to build on that skill set. And I also look at people that are stronger in that and try to reach out to them and see how have they done that. Because I know the people who were in the roles with me before, I see how they've been successful. Now I'm in a different role. How can I find people who have a similar skill set or what have you to learn from them? And not be scared to say that. I mean, I think that's one of the things in midlife or directors, a lot of people get stuck with fear of asking. A good example is I gave this class one day on regulatory intelligence and navigating the website, and a lot of the more senior people in the room said, oh, this is elementary, I don't need this. And they were the ones asking all the questions afterward because they didn't understand the value of certain things. So I think, one of the things is drop your ego, don't be scared, look at how you can acquire new skills and, make the best of whatever the situation is. I kind of went off tangent there. Sorry about that.
When Melissa first talked about that as a question, I had an amusing anecdote that I remember from when I first stepped over into management. I had been practicing with my physician partner for about 7 or 8 years. We, at that point, maybe close to 10, when we were at one point, and I stepped over into the management role. And you talk about culture shock, my wardrobe changed. And one day I walked in and she commented on it. And I hadn't really recognized, she said, "You're wearing suits all the time. Why are you always wearing suits?" But it was a recognition and the awareness of that culture of being, I was spending half of my day in a management role and half of my day sitting on the floor playing with kids as a pediatrician. But it was really important to have some of that to recognize that vision and that change in role. And by the same token, a lot of the same challenges I faced with all of a sudden now I was the boss of my peers. I was the physician who was in charge of a group of physicians who had been my peers. So it was learning some of that skill set of managing people, and some of that you can learn in school and recognize the things you can learn from the people around you, and some of it you just have to recognize where the skills are, what works and what doesn't. Look to others around you to see what works and what doesn't, and to ask for help when you need that. And so those, I think, were the two sort of extremes of that culture change of recognizing how do you be working with your peers and then stepping into a different role, having them also recognize that you've stepped into a different role, which was important. One of you mentioned being analytics, and as a scientist, I think the other thing that I still struggle with as a scientist, as a physician, I want to know everything before I make a decision. I want to know every piece of data that I could possibly know, and I want the advice around me. And in management, sometimes you need to go down the path of your best educated path to lead a team. And sometimes you just have to take that chance down that path, and that's something I still struggle with, wanting to know. And as one of my mentors and boss said to me, as a if you were my physician, I want you to know everything that there is to know about something before you decide which is the best treatment for me. But there's a little bit of learning how to go with your gut in a different sort of way. That continues to be challenging. I do still call on my pediatric experience and my teaching experience, again, having to work with mentoring, working with an employee, and trying to draw the analogy from a particular behavior that person was doing to try to let them see some shared behavior of how I needed that to change. And it became less threatening in a difficult conversation because I could call upon a familiar experience, something that was familiar to both of us in healthcare that had nothing to do with the immediate situation, but I could use that as an example to translate why it was that I felt like this particular behavior or this approach to doing things needed to change. So it was able to call upon some shared experience with healthcare to draw on that, my experience as a pediatrician, to help move some behavior in a direction with an employee.